Back to another episode of the Brawn Body Health and Fitness Podcast. I'm so glad that you're joining us again today. Today, I'm joined by Dr. Elizabeth Schultz to be discussing the vagus nerve, including the anatomy and functions of the vagus nerve, the polyvagal theory, and so much more, including chronic stress implications, exercises to help improve your vagus nerve health, and so much more. Liz has presented research at the Mid-Atlantic Regional Chapter for the American College of Sports Medicine Conference, as well as presenting directly in the United States Congress in Washington, D.C. She received her Bachelor's of Science in Exercise Science at West Chester University in May of 2019. Liz later went on to receive her doctorate in physical therapy at Lebanon Valley College in May of 2022. Liz believes in a holistic approach to rehab and incorporates all aspects of health into her overall patient plan of care. For more on Liz, you can find her on Instagram at Lizzie with a extra Y at the end, so that's Lizayy 1010. Before we get to this episode, here's a quick word from one of our sponsors. Dr. Schultz, welcome to the podcast. Really excited to have you on today.
Hello, thank you so much for having me.
So for people who aren't familiar with you, Liz, and who you are and that sort of thing, could you share a little bit about your backstory and who you are and what you've done?
Yeah, of course. So I got my undergraduate degree at West Chester University in exercise science. And then I went to Lebanon Valley and got my doctorate in physical therapy. I had a lot of different outpatient clinicals, one specifically with Dr. Ariane Missimer, who has her own private outpatient clinic where she incorporates a lot of the holistic approach to rehab. So I learned a lot about that. And I learned a lot about the vagus nerve from her, which we'll talk about today. And now I have a job lined up at Phoenix Physical Therapy in Douglasville. So I'm excited to soon get started on that.
So for people in central Pennsylvania, you're saying that they should definitely come see you when you start up here.
Yep, definitely. Douglasville, you got it.
Now, as you were going through school, you were doing and you published a little bit of research or presented some research as well, too, correct?
Yes, and I presented at the Mark ACSM as well.
So you're not just someone who, goes through school and, gets a degree or something like that. You're someone who's shown that you're committed to learning more by going out of your way to research things that we didn't know in the past and find out answers to them. And you've also had the benefit of learning from one of the top PTs in the country. Ariane has been, I probably butchered her name there, but she's been on CBS, ABC, like all
yeah, you name it. She's
news
been on
networks
it.
and all that sort of thing. And it's pretty rare that you find someone like that these days, it seems.
Yes, very thankful for her. She's taught me a lot for sure.
So tell me a little bit about your time with her and just overall the holistic approach to physical therapy.
Yeah, so actually when I was in West Chester is where I met her because she holds events called the Movement Paradigm, where you can go to these events and learn about nutrition, different mindsets, movement, all sorts of things. And that's what her clinic, the Movement Paradigm, incorporates. So she doesn't only have physical therapy there, she has strength and conditioning, she has some therapy like massage therapy and all that jazz. And she actually just became a functional medicine practitioner. So she incorporates that a lot with her clients. And her main thing is incorporating mindset, nutrition, and movement with every patient. Because as we know, it all is incorporated into your healing process and becoming the best version of yourself. So I definitely learned more of how the mindset and the nutrition play a part as with the physical therapy.
Yeah, that's amazing stuff. And I think that speaks volumes to the fact that I'll say in school, they typically tell you that, you can pinpoint the cause of a problem, right? If someone's got shoulder impingement, well, it's because they have a weak rotator cuff and weak scapular stabilizers, right?
Yeah.
When in reality, it's not clear, cut, and dry like that. I am willing to bet that at least 90% of the time, you don't actually know what caused someone's problem because there's
Yeah.
so many things that contribute to it, right?
Oh, yeah.
And it could be a nerve injury, it could be muscle weakness. The list goes on and on and on. So it's essential, in my opinion, to look at the root cause of things, but also look at the whole picture, right?
Yeah.
So not just settle for, here's how they're moving, here's how their strength is, but ask the questions like, how did you sleep last night? How have you been sleeping? Is
Yeah.
it is it the shoulder? Is it the hip? Whatever they came in to see you for, is that what's causing those issues? Or are those issues caused by something else? And one of the things that comes to mind for me about those kind of issues is this little nerve that, well, not so little nerve, I'll say, called the vagus nerve. And the reason for that is it's literally like connected to like practically everything from what I know,
Yeah.
right? So you're more well versed in this topic than I am, I'll say. So could you just kind of go over what the heck this vagus nerve is for people who aren't familiar with it or who are hearing for it for the first time now?
Yeah, of course. So it's our longest cranial nerve, and it's actually a pair of nerves. So you have your dorsal vagal and your ventral vagal, and it's going to originate from the brainstem, and it innervates muscles of the eyes, nose, throat, ear, lungs, heart, digestive tract, you name it. And it's 80% of our parasympathetic nervous system. So that's why it's really important to know how to hack into it. Because as we know, the parasympathetic nervous system is more of that rest and digest state. The polyvagal theory, which was developed by Dr. Stephen Porges, there's actually 3 different states in our nervous system, which we mainly know are fight and flight state, so our sympathetic, and then are more of our rest and digest, which is also known as like our social engagement stage, and that's with the ventral vagus nerve. But there's actually a third state called our freeze state, and that's the dorsal vagal. So with these, the freeze state is more when you're feeling hopeless. People can be depressed. That's when you shut down, things like that. With the fight or flight, as we know, that's when you can feel anxious, worried, anger. That's more of our stress state. And then our social engagement state, which is the state we want to be in, is where you feel mindful and connected and grounded and joyful. So with these 3, a way that you can kind of start to control your nervous system and take charge of it is to name each of these states. So name them in a way that makes sense to you. So to give you an example, with the freeze state, I like to call that like my overwhelmed state. Then with the fight or flight state, I like to say that's my stress state. And then with the social engagement, I like to call that my present or connected state. So name each one of those. The next what you can do is write down the triggers that put you into that fight or flight or freeze state. So once again, to give you an example, for my fight or flight, maybe that's when the house is a mess or I have a test coming up. That's when I start to feel kind of stressed. With my freeze state, that might be when I have a ton of stuff to do or I feel like the weight of the world is coming down on me. I start to get really overwhelmed. So write down those triggers of what force you into those states. The next what you can do for the social engagement state is write down those things that bring you back to that joyful state. So for me, that's like dancing in the kitchen or hanging out with my friends or a 60-second hug, any of those things. So that you can build your own personal tools of how to pull you out when you're feeling stressed or overwhelmed, whatever you make the word for those states, so that you can continue to be in that relaxed state and that parasympathetic state.
Gotcha. So backtracking a little bit here, do both the dorsal and ventral branches, dorsal, for those who don't know, also means posterior, and ventral also means anterior. So one is in front and one is behind. Do those branches both go to all the various organs in the thoracic, like and abdominal cavities, I'll say, like the heart, the lungs, all that sort of thing. Are both of those branches going to all those organs, or is it just one?
Yeah, so it's both. So that's like the vagus nerve, it's split up into those two, but they both innervate the same things.
Okay, and they're literally hitting, like we mentioned before, everything from the heart and lung down to the gut and your other abdominal organs, liver, spleen, pancreas, kidney, you name it.
Yep.
So it's interesting how this one nerve literally connects everything together. Now,
Yeah.
I like that you brought up the polyvagal theory, and I'm someone who's not overly familiar with the three levels, like you mentioned. I'm mostly familiar with fight or flight, right? I think that's what everyone's heard of before. Like, you're stressed. And
Yeah.
it seems to me like the fight or flight mode is almost like the kind of in between, or your balance between that freeze point that you mentioned and the social engagement point. And it's almost like a spot of, like, I'll say, internal conflict between your dorsal branch and your ventral branch, if that makes sense.
Yeah.
Interesting. So you mentioned different things people can do to help find like triggers that put them in one state over another. Going along with that further, do you suggest people look into like a mindfulness practice to do that, or journaling, or seek professional help? How can people help themselves to figure out where they're at and what their causes of different states throughout the day is, I'll say?
Yes, that's a great question. I would say all of the above, but definitely, like I said, journaling. So when you're feeling anxious or stressed or whatever, kind of just taking a step back and identifying that emotion with the words. So I'm feeling anxious, I'm feeling stressed, I'm feeling overwhelmed. So like I said, kind of put a name to that state, and then figure out what are the triggers, why are you feeling that way, and then what can you do about it. So if you write down, journaling, like a name for each of the state, the triggers that put you in those states, and then the things that help you bring you back into that social engagement state, write it all down. So when you're feeling a certain way like that, you can kind of look back and be like, okay, this is what I'm feeling, what do I do about it? And that can help regulate your nervous system so that you have control over it.
And I would imagine a big piece of that is focusing on the things that you can control, right?
Yes.
So if you're driving to work, and every time you drive to work, you get super stressed and pissed off or whatever because, you're going through the traffic and someone else has road rage and they're blaring on the horn, or you're 5 minutes late or whatever it is, then you have to look at it and focus on the things that are within your own control, right? Maybe you leave 5 minutes earlier. You can't control the other motorists, though. You can't control the guy blaring on his horn. You can't control someone cutting you off in traffic. So you have to kind of keep things within your own realm, I'll say, and not focus on the things that you cannot have an impact on.
Yes, definitely. And a cool way to evaluate if you're in that high vagal tone or if you have low vagal tone, it's called the uvula test, and this is specifically in the pharyngeal branch of the ventral vagus. And this is from Stanley Rosenberg. But either you can do this to yourself, or if you're a PT or clinician, you can evaluate this on your patient. So you'll do is you'll have them open their mouth, and you can shine a flashlight back there, and then look at the uvula, so the little thing hanging in the back of your throat, because that is stimulated by the vagus nerve. And you're going to make a ah sound. And when you do that, you're going to watch the uvula. If it raises in a symmetrical way, then you have high vagal tone. But if it deviates to one side, then you have low vagal tone in that right now, which you can change. But that just gives you an idea of if you are in that social engagement stage, or if you might be in that fight or flight or freeze state.
And what do you commonly see with people and patients and that sort of thing? Do you think most people have a very high vagal tone or a low vagal tone?
Definitely say low vagal tone, because as we know, we're mainly in a stress state because it's a stressful world, and a lot of people don't know the tools that they can have in order to get them back to a more relaxed state.
You mean to tell me that living in America in 2022 is stressful?
I
Really?
know, right? Isn't that crazy? Who would have thought?
Oh my. So if people aren't able to do the uvula test, so say I'm at home and, I'm looking in the mirror, but I can't really figure out, what my uvula is or how it's moving or whatever it is that way. What else could people use to help them determine if they have issues with their sympathetic, parasympathetic balance or tone of the vagus nerve, I'll say?
I'd say just identifying how you're feeling in that moment. And you can also look at your gut. Are you feeling more bloated? Are you constipated? Are you feeling kind of crappy in that way?
Well, that just took a crappy turn. Wow. I think the gut health is key. And I think there's so many other things that go along with a stressed state, right? So when I think back to what we were talking about before, the polyvagal theory, if you're in that state of social engagement, so that would be the ventral side of the vagus nerve that's acting there. If you're in that happy-go-lucky state, for lack of a better way to put it, then I picture that being, your I'll speak in terms of ancestrally because that's how I think about it. I picture that being, you're at your camp or home or wherever, you're comfortable, you're content, you're well fed, you have nothing to worry about. Then when we get into that fight or flight mode, that starts to be more of a survival pattern, I think. So in my mind, that's where I think of we are currently running away from a saber-toothed tiger. What's going to happen? Your heart rate is going to increase. Your blood vessels are going to dilate to allow for more blood to flow through your body. Or I might have that backwards. It might be constrict in the peripheral and dilate in the abdominal. But either way, your blood vessels are going to change. Your rate's going to increase. Your eyes are going to widen because you just saw something scary. And the more light you can let in, the better you're going to be able to see as you're running away from the saber-toothed tiger, and so on. It's a survival pattern. It's something that I think, and I'm no expert on this, but I think it possibly might have evolved in our species over time to help keep us alive from things like saber-toothed tigers that could kill us. And then you go one tier up to the freeze, which is that full dorsal tone. So that's the moment that you initially see that saber-toothed tiger. That's the moment when you just kind of freeze and think, oh my gosh, what do I do now? Right? That's when you feel helpless. That's when you stop and don't do anything. And I think when you think about those three situations, it kind of the effects make a little bit more sense to me anyways, right? So if I'm in a state of fight or flight mode, then my gut motility, my GI motility, is probably going to slow down because the last thing I want when I'm running away from a saber-toothed tiger is to have to stop and find the porta-john, right?
Yeah.
Well, if I'm at home resting comfortably, I just ate and I'm chilling on the couch, guess what? If I've got to go to the bathroom, that's probably a good time to do so.
That's a great point. And even just clocking in, seeing how is your heart beating fast? Are you feeling hungry? Are you feeling full? Just kind of being able to tap in and at certain points during the day, which we like to call like interoception, knowing how you're feeling, what's going on in your body, being able to be in tune with your body, which is a great thing to practice and get the hang of, because if you can start being in tune with your body, then you can better help yourself and regulate your nervous system.
Right. And if you're in tune with your body, you'll know when things are going good and going well. You'll also know when things are not going well. And when they're not going well, you're probably able to seek out another opinion faster, which means you'll be back to doing the things that you want to do quicker, which is obviously a good goal for everyone. No one likes being on the sidelines for a long period of time. Before I went on my little rant about the saber-toothed tiger, though, you mentioned gut health.
Yes.
And people, when I think of the vagus nerve, anyways, I think gut health is one of the most important connections because one, the gut is huge. Like you can literally jump rope with your intestines. I mean, we
Yeah.
pull them out in our cadaver dissection, and what are they, like 20 feet long? You got 20 feet of intestines. Like it
Yeah.
is wicked
Crazy.
wild how much there is, and the fact that there is literally a nerve that runs from your brain to your gut, and it's all over the place there, and it's also connected to your heart, it's connected to your liver, that sort of thing. Like there is literally a direct connection from your gut to your brain. So people talk
Yeah.
about gut
Oh yeah.
instinct and thinking with their gut, and that's kind of where it comes from in my mind, anyways. That's
Hmm.
where the connection. But I'm curious, what the heck does the vagus nerve have to do with gut health, or vice versa? What does the gut health have to do with the vagus nerve and that kind of gut brain connection that I
Yeah, of course. And real quick, just so people know, your gut is 70% of your immune system. So it's very important. And when you have low vagal tone, that's when you can have things like leaky gut, irritable bowel syndrome, SIBO, so small intestine bacterial overgrowth, all of that not fun jazz.
mentioned. What is leaky gut for people who don't know what it is?
So you have these connections in your epithelium in your gut, and they can start to kind of separate, which will let the toxins, bacteria, and things go pass through your gut into your bloodstream. And that will trigger the immune response and cause a lot of inflammation in the body. So basically, your body's not absorbing things well, and that's why it's called leaky gut, because things are leaking between the epithelium into your bloodstream, causing a lot of inflammation.
So instead of going through a filter like your liver first,
Yeah.
stuff goes right from your gut into your blood without getting
Yeah.
filtered first.
Yeah. So not fun. So
Can I sign up for that?
yeah. But basically the vagus nerve does a lot of things, basically making sure you're breaking down food properly and absorbing it properly. So it helps to upregulate the breakdown of your solid foods, stimulates the release of those digestive enzymes and bile, the secretion of saliva, which we know is like the first step in the digestive process. So all of those things help break down the food, and then it will decrease the inflammation and the intestinal permeability. So decrease the chance of, those connections decreasing and letting the toxins and bacteria get into your bloodstream. And it slows gastric emptying, so making sure it doesn't go too fast through your digestive process. You're not able to absorb what you need to absorb and properly break it down. It coordinates motility in the intestines, so making sure you're getting that wave-like motion in the large intestine going to the rectum so that you can excrete properly. So it's very huge. A good thing to do, which I like to do before you eat, is just take like 5 diaphragmatic breaths, because as we know, diaphragmatic breathing is going to stimulate the vagus nerve. So just taking those couple deep diaphragmatic breaths will help you increase your vagal tone so that you can make sure that you're properly breaking down and absorbing your food.
Right. And there's a lot I want to go through about this topic. First, you mentioned about the importance of secretion of saliva and different enzymes and that sort of thing to break down the food that you're eating. And I think a lot of people forget that the whole digestive process, as glorious and glamorous as it is, literally starts at the mouth.
Yeah.
So if you are not chewing your food enough and you're not letting your body take the time it needs to secrete saliva to start breaking food down, then you're putting yourself behind from the start. And that alone can set you up for further stomach and gut issues and upset and that sort of thing. And the reason I bring this up is because I think gut health is a very overlooked area of health and medicine in general. A lot of people I know think that things like bloating and farting and all that sort of thing is normal and acceptable and just a way of life. And, believe it or not, you're not supposed to have farts that can clear a room. Like that's not normal. That's not healthy. And oddly enough, we talked earlier about how the vagus nerve literally connects like literally everything. It
Yeah.
also plays a role in swallowing function and throat sensation. So
Mm-hmm.
naturally, this thing hits all ends of digestion from the start to the finish. And
Yes.
I think it's important to bring that up first.
Mm-hmm.
Second, just kind of following the pathway down here, right? So now we go into the stomach and we go into the intestines and that sort of thing. That vagal activation, I'll say, so firing of a nerve pathway, sending a nerve conduction down a nerve, for
Mm-hmm.
lack of a better way to put it. That's going to, you said, stimulate release of digestive enzymes and bile in the stomach and intestines and liver and all
Mm-hmm.
that. Again, all that beautiful stuff. And it's going to slow gastric emptying, which is going to give you more time to break it down. That all seems like good things. And then you mentioned the role of inflammation. And inflammation is one of those I want to call it like a hot topic or buzzword right now. Like people
Yeah.
are constantly being told, like, oh well, it's an inflammatory process. Take an
Mm-hmm.
anti-inflammatory for it. But I don't think people fully understand what is meant by inflammation. And I think that inflammation gets a lot more confusing when you tell people that it's part of the healing process because they
Mm-hmm.
go, okay, well, what am I healing from? So,
Yeah.
kind of in your terms, I'll say, how would you say that inflammation or inflammatory role within the gut comes into play here? And what role is that playing in poor gut health versus good gut health?
Yeah. So, like I said, your d- digestive system is 70% of your immune system. So, if you're not taking care of that, your immune system's going to be down. It could trigger a lot of inflammation in your body. Like I said, the intestinal permeability. So, increasing the gap between those epithelial connections, which can lead to toxins and bad things going into your body. And when you have chronic inflammation, which we know, like acute inflammation, let's say you get a knee injury or something like that, acute inflammation isn't bad. So as we know, you don't want to take those NSAIDs, you don't want to put the ice on it, let your body do what it needs to do. But when it becomes chronic, that's when it can become an issue. It can cause a whole host of things such as joint pain, bloating, brain fog, all that jazz, like we know, because of the gut brain connection. And that's another interesting thing to talk about, that when you're feeling depressed and anxious and all that, which we know is the different states that you can be in, that also can be coming from your gut health. So, due to that gut brain connection. So, if you're feeling depressed and anxious a lot, I think tapping into your vagus nerve is important, as well as your gut health, to, if you're eating the right things, taking the time to eat properly, it can all contribute to taking away that depression and anxiety and all those awful feelings that you have.
Right. And they've done studies in people that look at, things like mental health and mood and that sort of thing, and overall gut health and different gut
Mm-hmm.
biomarkers. Or there's this other kind of trendy thing right now. I think it's disgusting. But it's called a fecal transplant, where they literally take one person's crap and put it into someone else. Like, it, to me, it's disgusting. But I've worked with people who have studied it and that sort of thing in the past. We had Dr. Dan Clark, the microbiologist, on a little while ago, and he has looked into it a little bit more than I have, and he's kind of taught me a bit about it. And it's crazy how the bacteria from one person's gut can make a beneficial impact on another person's mood. So there's
Mm-hmm.
clearly some kind of connection between the bacteria in your gut and how you feel and how you're doing overall.
Mm-hmm.
There's more bacteria in your gut cell wise than you have cells in your entire body. So, in a
Yeah.
way, you as a person are actually all the things that are living inside you. And that sounds really weird to say, but it's kind of how it is. And I think the biggest thing too with the gut health and inflammation standpoint, if you start to notice any of the signs that you outlined earlier, then something is amiss. Maybe it's something in your life. Maybe it's something in your diet. Maybe it's something in how you're eating your food, right? Maybe you're chewing and talking at the same time, and that's allowing a lot more air to get into your gut than normal, right? There's
Yeah.
a lot of different things, and it's hard to pinpoint that one root cause of everything without looking at the whole picture.
Yeah.
But in general, it's important to keep all those things in mind. One, and two, if you start to notice those things, understand that inflammatory process. So I'm feeling these things because I have junctions in my intestines and gut lining that should be tightly bound, but instead they're actually gapped right now. And
Yeah.
stuff is going from my gut into my body. And my body is responding by increasing tissue temperature, increasing blood flow to that area, and increasing flow of white blood cells to that area, because whatever got out of your gut lining is in a place that it should not be, and your body's going to react accordingly to get it either back to where it should be or wipe it out and destroy it and then clear it out, because naturally we don't want things where they should not be. And that whole process, unfortunately, is going to add wear and tear to your body. So that's where things that you mentioned, like brain fog or fatigue or malaise or just not feeling well or bloating or being gassy, that's where all those things come into play.
Yeah.
Basically that's your body's way of saying something that we just did is not right. And this is how we're going to let you know that it's not right. It's kind of like your internal problem sensor, if that's a thing.
Yeah. And like we know, there's a lot of stress in this world, and chronic stress can slowly kill you. So it's definitely good to, which we'll go over soon, some of these vagus nerve exercises you can do to keep you into that social engagement, decrease the stress in your life so that you can.
What can people do? So you just mentioned a great point. The world is freaking stressful. I mean, at the time we're recording this, gasoline prices just hit $4.70 a gallon where I'm at.
Yeah.
And when you're about to be graduating from college after 6 seeing gas prices go right up might add a little bit of stress to
the
you.
Housing market.
At least from a financial standpoint. So what should people be doing to help reduce their stress level and help to optimize their own internal environment, I'll say, from a neural standpoint?
Yeah, so great question. There's tons of vagus nerve hacks, if you will, or exercises, which we can link at them. But Dr. Aaron Missimer has tons of YouTube videos of all of these things. Some simple ways, since the vagus nerve goes through your diaphragm, doing diaphragmatic breathing throughout the day. Humming, since it innervates the muscles of your throat. So you can just hum and sing, laugh, things like that during your day. Even just splashing some cold water on your face helps to stimulate the vagus nerve. And then one of my favorites is called the salamander. But once again, you can check out a lot of these videos and pick which ones are kind of your favorite. But for the salamander, what you do is you interlace your fingers, put them behind your head, just like at the base of your skull. And what that's going to do is help bring blood flow to your brainstem, which is where the vagus nerve originates. Then you're going to slightly side bend to one side, and you're going to gently look with your eyes the other direction. And you're going to hold this position for 30 seconds. So if that makes sense, let's say we're side bending to the right, we're going to look with our eyes to the left. But keeping your head,
the whole head,
just your eyes. So keeping your head straight, because once again, this is helping to bring blood flow to your brainstem. So you're gonna hold that for 30 seconds.
I'm going back and forth like a TikTok right now.
Yeah. But remember, interlace your fingers, put them behind your head, face your skull. Good. Side bend, just your upper body. There you go. And look with your eyes the other direction. Yep. Keep your head straight.
As straight as it goes.
Yep. And then move just your eyes the other direction.
Oh, this is hard.
Yep. And you're going to hold that for 30 seconds, or you might sigh, swallow, or yawn, which is a good response. That means you're creating the relaxation response.
I feel like I have to swallow pretty often. I don't know if that's a scientific thing, but I got that like 5 times during doing that.
Yeah, well, that's good. And then you would do the other side, and that you should feel kind of a calmness afterwards. It's a pretty easy one to do during your day if you're sitting at your desk or
So it's a way to
before.
turn on that internal Zen mode wherever you are.
Yeah. Another great one is the trapezius twist, and this can help a lot with posture because it wakes up those trapezius muscles back there. So you're gonna hold on to your elbows, interlacing your arms. You're gonna rock back and forth, just your upper body at your abdomen level. So rock side to side instead of just your arms.
Oh, geez, this is hard.
Yep, there you go. At your abdomen level. You're gonna do that 5 times, then you're gonna do it at your chest level 5 times, and then above your head 5 times.
I'm not sure if my shoulders are gonna put up with this, but we're trying here.
Yep, so especially when we're sitting at desks all day or sitting in the car all day, that's a good one to do at the end of the day or while you're driving or working to kind of better that posture and stimulate that vagus nerve. So, but like I said, there's tons of them. There's ones for the digestive tract as well that she goes over, but those are some of the easier ones to do during your day and some of my favorites. So yeah.
What effects can people expect from those exercises, and how long would you say it takes to notice those effects? Like if I do them, will I notice benefit right away, or will it take a few days? Or
so you'll see the benefit right away. Like I said, you usually sigh, swallow, or yawn during most of them, which is telling you you're in that relaxation response. And but sometimes if you're like super stressed or lots going on, try a couple different. Sometimes it takes doing a couple different of them to get you back in that state. Even as clinicians, when we're busy all day and you see a lot of patients, I like to do this between patients sometimes to bring myself back because maybe I just worked with a really difficult patient and I have a lot going on in my mind. So doing one of these real quick to see the next one, because another great thing I learned is through this vagus nerve is that you can't be curious and anxious at the same time. So that was really emphasized during my clinical variant, which is really powerful, I think. So when you're anxious, especially when you're a student and you're seeing all these new patients, and you have 10 million thoughts in your head while you're working with them, and you can't fully be present and curious with the patient because you're not in that parasympathetic state. So this is really good for clinicians to know as well, or even for anyone out there. So when you're feeling anxious, it's good to do some of these things so that you can be present during your day and you can be curious and really work well with your patients.
For sure. It's the kind of thing that you need to keep asking questions and peeling back layers, kind of like an onion, for lack of a better way to put it, because the second that you stop doing that and settle for, okay, I have enough information, or okay, that's good enough, that's the second that you lose your effectiveness, in my own opinion. Because as we're talking about these things, right, most people would not consider the role of the vagus nerve and the role of your sympathetic and parasympathetic nervous system balance internally in the role of musculoskeletal pain or movement conditions or that sort of thing. But in reality, I'll paint the picture like this, right? So say you're someone who, I'll use a gym goer. I'll use myself as an example. How can you be better than that, right?
Yeah.
But say you're someone who's 24 years old and you go to the gym 6 days a week, right? So you go to the gym, you work out, all is well and good. You're making gains, seeing progress, all that sort of thing. Well, what if instead of sleeping 7.5 hours a night like you usually do, you start sleeping 4 hours a night? Now, that might not impact you at all at first, but over time, if you're not giving your body a chance to rest and recover and come back stronger, right? Because you don't actually build muscle while working out. You build muscle after you work out, after your body's recovered and had a chance to repair the damages that exercise induced. After you've done that is when you recover. So if you don't give your body a chance to recover and rebuild, and you're constantly chipping away at the muscle you have, not letting your body add in new Legos, I'll say. I like to compare muscle to Legos in a sense. So if we start taking away from our Lego tower one by one, and we never put a new one in, eventually we're not going to have anything left standing. And that lack of sleep could have caused a weakness somewhere. And all of a sudden, we noticed that when maybe we're doing TRX chest flies one day and we hear a really loud snap. And all of a sudden, we just kind of freak out, like, what the heck? What just happened? What was going on? And I say that because I think that's an example that everyone can relate to in one way or another, right? We go through life and, we try and be fit and active and healthy as we can. But sometimes life gets crazy, like we mentioned a few times. You might get a new job, you might change, clinical locations or where you're living or whatever. You might change to a new time zone. Something might happen in your family, your relationship, whatever it is you've got going on. There's pretty much a guarantee that chaos will come about at some point in your life. And we have to have a good system in place to get a handle on that and keep ourselves in this state of, I'll say, balance, for lack of a better way to put it. Because if we don't, and we start losing one Lego every day or two Legos every day, and we start chipping away at ourselves, before you know it, we're going to end up with something slightly scary happening that gets our attention, straw to break the camel's back. And that's going to lead us to kind of reset and restart that whole cycle. And hopefully we don't make the same mistake again. But more often than not, I think most people do make that mistake for whatever reason. I'm not sure. I think that's a multifactorial thing that we won't get into today. But it's better to do it right. And when you start to notice things aren't going right, get a handle on these things. And everything I just mentioned, from overall muscle function to your overall sleep, comes back to this vagus nerve and this sympathetic parasympathetic balance in one way or another. And if my own little story and TED talk that I just went on, for lack of a better way to put it, doesn't speak volumes to that enough, then I'd say look at people like Wim Hof. The dude literally ran a marathon barefoot in the Arctic Circle. That is the peak of human performance in my mind. And he did it through cold exposure, through breathing techniques and all these different things that optimize the function of your parasympathetic nervous system. So if he can do it, then that seems to make me think that it's possible for other people as well.
Yeah, and you brought up a lot of great points, and that's why people who think what patient would benefit from this, everyone. Because the first thing I work on with patients is getting them to diaphragmatically breathe. So assessing their breathing, because most people, as we know, breathe up in our neck area. And if just getting them to diaphragmatically breathe will automatically put you in that parasympathetic state, which you need to heal. People don't realize that. If you're in a sympathetic state, no matter how hard you work on that patient, they're not going to fully heal, because they aren't in that rest and digest state. They aren't in that healing state. So first thing I like to work on is that diaphragmatic breathing, which we also know is beneficial to help stimulate those deep core muscles as well. Get all that going. And then, with any patient, like we said, with the holistic approach is, figuring out what your stress levels are, how you're sleeping, your diet, all those things. So these vagus nerve hacks, if you will, are another tool in that person's toolbox to help decrease their stress in their life, so they don't have chronic inflammation and all of these awful things that come with it. So as we know, other things people can do is like meditation, journaling, all of that. But teaching them some of these vagus nerve exercises is just giving them that other tool in the toolbox to help with their healing process.
Definitely, for sure. Do you have any other kind of tools or hacks or exercises that you like to give people?
No, those are the main ones I give people because they're simple and easy to do, especially during your day. But like I said, if you check out the YouTube videos, there's a ton of other ones that specifically hit on the like digestive tract and things like that. There's so many, but those are the ones I mainly teach people because they are easy to remember and easy to do during the day.
Right. And I'm curious too, because I know we have a few physical therapists who listen to the podcast. And if you're not a physical therapist, you might be able to skip over the next minute or two. But one of the things PTs often ask is billing, because, when it comes to insurance or that sort of thing, it might be difficult to justify, doing diaphragmatic breathing for, lower back pain, for example. So is there a good way to go about justifying it to insurance or screening for dysfunctional breathing patterns or that sort of thing?
Yeah, so that's a good question. I'm not, like I said, the clinic I was at was cash-based, so we didn't have to totally worry about that. But that is a thing I'm thinking about once I start working at my job, because it'll be insurance-based, how to go about billing some of these things or justifying it. But I think if you state how these things play a part in their pain or in their the problem that they came in with, functionally, how this is contributing to it, I think you should be good to go. So maybe saying, if they're not breathing properly, if they have increased stress, that can cause increased inflammation in the body and contribute to things like fatigue, pain, whatever they're feeling. But yeah, that's definitely gonna be something to work on, to how to word it, that the insurance companies will buy into it. But I think if you can justify how it functionally affects them, it should be good. But
and
it
this
is
is
a challenge.
I'm certainly not an expert in it by any means myself. But I think a big battle for people and patients is advocating for them and helping whoever is paying for their service to recognize that what you're doing for them is going to help treat their current problem and condition and help prevent future conditions from developing. AKA, it's going to get them better now and it's going to save money in the long run, hopefully. And I think a good way to go about this is on your initial eval, on day 1 or day 0, whatever it is, ask about breathing and look at how they're breathing. So if you see someone doing a lot of upper chest breathing, it's very common, very easy to pick out. You write it down and you make a note of it. And if you see someone's very chill, relaxed, laid back, you make a note of it too, because guess what? That person might be fine with it, right? Not everyone is an upper chest breather. Not everyone recruits their scalene muscles to breathe, but some people do. So you look at it, and if it's there, you make a note. It takes like 5-10 seconds, maybe at most. And if you write it down, then I would also, I know a lot of people, a lot of PTs are obsessed with asking about pain. What's your pain level? What's your pain score? 0 to 10, what are we at today? And I've mentioned before to people, I haven't asked someone about pain in months at this point, because there's a lot more to it than just their pain level. But if you are someone who does ask about a patient's pain, ask about it on day 1. And then when your progress note, reeval, whatever comes up in, a month or whatever it is, then ask them again. Because I'm willing to bet if you've been doing breathing exercises and helping them stimulate a more sense of balance and calmness in their life, then they're probably going to have a lot lower pain level than before when they came in. So I kind of look at that as a way to treat the pain in addition to treating mechanical things, right? So when we think of pain, it can be neurophysiological and mechanical in nature. And I think both contribute to pain overall. So you can say this is kind of a way to treat both neurophysiological and mechanical causes of pain. Because maybe they have neck pain because they're using their scalenes and upper trap and all that sort of junk to breathe instead of the diaphragm. Now, that's a little bit of a loaded statement. Everyone uses their diaphragm to breathe, but not everyone gets good abdominal excursion while breathing. Most people, so just keeping that in mind. And I'm saying that more to just kind of check myself there, because I don't want people to take that the wrong way, if that makes sense.
Yeah. So definitely, first thing, like I said, trying to journal, mapping out kind of the nervous system, each state, give it a name, write down your triggers, write down the things that help you get into that social engagement stage, and then incorporating some of these vagus nerve hacks throughout your day. These are all just extra tools to have in your toolbox to really, if you, let's say, decrease the time of the recovery process.
For sure, for sure. I feel like we've talked at length about the vagus nerve and the sympathetic and parasympathetic nervous system, Liz. Is there anything else that you want to mention or bring up about that we haven't discussed already?
No, I mean, I do have this little tip, if you will, if you want to improve your forward flexion pattern for your deadlift.
Deadlifting? I need my deadlift. So.
This is your favorite topic. So basically, if you hold out a pencil or even use your thumb, arm's length, right? You're staring at it. You bring it towards your nose, keeping your eyes on the pencil or thumb, whatever you're using. And bringing it towards your nose and following with your eyes is actually going to stimulate cranial nerve 3 and 4. And yep, so keep it on.
Yep, so take a pen or a pencil and move it towards your eyes and away from your eyes. It's kind of like
just so actually you're going to slowly move it towards your nose, and then once you get to your nose, you're going to hold it for 5 seconds. But while you do that, you're going to hum, because that's going to stimulate the vagus nerve.
Well, this should turn some heads when I'm warming up for deadlifts.
I know. And those cranial nerves that we're stimulating are part of the midbrain, which will enhance your flexor tone in your body. So you can do that. You can even check it. So you can go down and touch your toe, try to touch your toes, then do this exercise, and then go down and touch your toes again. It should improve that flexor pattern, and then you should be able to get down there for your deadlift.
So you're saying to try this before you go to the gym and do it for the
Yeah, you can. You can just try to touch your toes, see how far you get, then try this exercise, try to go down and touch your toes again, see how much further you're at. And then to keep that flexor, that increase in your flexor pattern, you can add weight, so deadlift with it. Interesting.
So you mean to tell me that tight hamstrings aren't the only thing that prevents me from reaching the floor?
Yeah, isn't that crazy?
Yeah, I always knew that I had a few screws loose up top there. I used to say, in PT, we can only fix from the neck down, but it actually goes to show that sometimes the problems that you run into from the neck down are actually due to things up higher that we can impact.
Yeah.
Liz, this has been an amazing episode. Do you have any kind of closing thoughts or closing remarks that you want people to take away from our discussion thus far?
No, just really, either for clinician or just whoever, really focus in on those stress levels, see what states you're in, like I said, journal those things I talked about. And yeah, just don't forget about the vagus nerve. It's so powerful, so important. It's and I can't wait to learn even more and more about it as I go on. But yeah, it's been really great talking to you about this, and I hope a lot of people learn a lot from it.
For sure. Liz, where can people find out more about you if they want to connect with you or collaborate on you, that sort of thing? Are you on Instagram, or are we still trying to send you MySpace requests?
Fun fact, I actually never had MySpace.
Really? Wow.
Yeah, I know. It's crazy. Yes, I do have an Instagram. We can link that. I can send you can link it to this video. Is that how it works?
Yeah, you can send me your Instagram.
Yeah, Instagram, Facebook, Elizabeth Schultz. So you can find me.
Is it still on Facebook?
I feel like it's getting more popular.
Oh, it's on the comeback.
Yeah. TikTok.
Really?
Don't follow me on TikTok.
Right.
Yeah, thank you for having me on again. This has been really fun.
Thank you for listening to this episode of the Brawn Body Health and Fitness Podcast. If you like this episode, please make sure you subscribe to the podcast on your favorite platform and share this episode with a friend who you think would enjoy hearing it. Additionally, if you want to help support this podcast and keep future episodes going, please check out our links below where you can support us directly or through engaging in any of our affiliate marketing links. Last, please make sure you check us out on social media at Brawn Body and leave a 5-star review, especially if you're listening on iTunes or Spotify.